Hello, it's Dr. Rhonda Johnson. Today's Tuesday, September 21st, 2021. Today I'm going to be doing a refresher. You know, the virus, the SARS-CoV-2 virus and its variants has really found the perfect hosts, human beings. The U.S. coronavirus death toll yesterday surpassed 675,000 on Monday, and more Americans have died from COVID than the estimated number of Americans who died from the 1918 flu pandemic. This COVID-19 pandemic, folks, is an infectious disease crisis between human beings, our behavior, and this unseen virus. You know, this virus is programmed to do one thing. It's like a genetic parasite. It's programmed to go into our cells and replicate. It can't survive without a host, and its perfect hosts are humans. And when it replicates, it causes an infection. And this replication has to take place inside a certain cell, the ACE2 receptor, cells with the ACE2 receptor. This happens anywhere in the world, whether it's a man, woman, adult, or child. Our human cells are all the same to this virus, no matter where they find us. Remember, the virus does not discriminate. Remember that it infects cells in the lungs, the heart, kidneys, intestines, brain, and most deadly, the blood vessels. The very blood vessels that our human bodies depend on for life. It makes our blood vessels leaky, out of whack, and then ultimately our bodies can't get the life-needed oxygen from our lungs to all the tissues that depend on oxygen in our body. I did a video 1 year ago this month, and I said at that time that this virus has caused a global pandemic with over 30 million people actively infected, and we are getting close to over 1 million dead. Well, 12 months later now, globally, there are over 229 million confirmed coronavirus cases, and probably a lot more that aren't confirmed because testing isn't widely available around the world. And more than 4.7 million people have died worldwide. And again, that number is probably a vast underestimate just because testing is not available widely in many places of the world. Remember, this virus continues to baffle the best and the brightest scientists, researchers, and medical doctors, although we have made enormous progress in the past year. In fact, we've had over 5.94 billion vaccine doses administered worldwide, but we still have a long way to go. The continent of Africa remains the continent with the least number of coronavirus vaccine doses given. Remember, while we're doing this refresh, that this virus is not just one virus but multiple strains, and the current dominant variant, Delta, is more contagious, according to the CDC, than measles, Ebola, the flu, and smallpox. But what does that really mean by saying that the Delta variant is extremely contagious? One expert who's trained in infectious diseases wrote that it only takes 1 second of exposure to get infected. 1 second. Now, Chinese scientists, on the other hand, say it takes about 15 seconds to get exposed and infected with Delta. But either way, the bottom line is it doesn't take very long. Now, whether or not you get infected depends on a lot of different factors for each person. So, like catching Delta depends on a lot of host factors. Some people have stronger immune systems, and ventilation makes a huge difference in terms of how much virus is suspended in the air. And then there's personal behavior, the most important being wearing a face mask. Sometimes we forget that this virus has killed unborn babies, mothers who are carrying their babies, infants, children, teens, young adults, adults in the most productive years of their life. It's killed our grandparents, our elders, and it's killed more men than women for reasons that aren't understood. As we refresh, remember that this virus can cause massive blood clotting, an inability to breathe, sudden cardiac death, diarrhea, and impaired functioning of the human brain, leading to early dementia-like symptoms in people who have recovered. Remember that many people who have survived need dialysis and extensive medical care. Some have lost major limbs. We are at a critical point. When people across the world all should be working together to address the most critical threat to life as we know it, we see chaos, finger-pointing, deliberate misinformation, and dangerous propaganda that's being put forth. And we see vaccine inequity in many parts of the country and the world. Remember, while we're refreshing, please, that a mask is not a political statement. It's protection. Please wear it if you're above 2 years of age. Your life just might depend on it. We can't control viruses in our environment. They are going to keep coming. But sometimes I think we forget that we have fought and won battles with viruses many times through vaccination, such as polio, hepatitis A, hepatitis B, Rubella, Mumps, Rotavirus, Measles, smallpox, yellow fever, and Rabies. These are all viral infections that we've almost eliminated through vaccination. So in closing, let's keep having these conversations with our friends and family who remain unvaccinated. And I do hope people will continue to take protection that's provided by the COVID vaccine. No, it's not perfect. You can still get COVID. I certainly know that. But it will help defend your body when it needs all the help it can get. And please do keep your mask on when in public, indoors or outdoors, and wash your hands. And also share this video because we have to combat misinformation at every opportunity. Thank you so much for listening. And as always, my views are my own. Stay safe, folks, and have a blessed day.